by mobile to the public, and also we participate in the international educational activities like World Kidney Day. We celebrate there. So these are mainly the help we do for the kidney patient.
But doctor, what is the level that the patient should use the kidney machine?
Good. We mentioned earlier that the kidney failure are stages. And when we reach to the stage of end-stage renal disease, what I mean is that the kidney function is less than 15% of normal. At this stage, when we label the patient as end-stage renal disease, this patient cannot live without renal replacement therapy, either in the form of dialysis or in the form of transplantation. So usually when the kidney function is less than 15% of its normal.
So I've heard that if someone has high pressure in his blood, it's gonna affect the kidney. Or
yeah, of course.
This is one of the main.
Yeah, this is what we mentioned earlier, that hypertension is the second most common cause of renal failure in adults.
What's the first one? Is it diabetes?
The diabetes, yeah.
Doctor, can you tell us exactly where Prince Salman Center for Kidney Diseases is, or located, so that we can direct our viewers in case they want to do any checkups?
Yeah, Prince Salman Center, Prince Salman Kidney Center is located in Rabwa area, in Nahda Street.
So anyone can go there and can clearly see the center, Rabwa area, Nahda Street. If you guys need to check up on yourselves, it's very important, crucial. You might be sitting home and you might never know that you are in a serious situation. You have high blood pressure for the last 15 years. You always think that the headache you get is only a normal headache and need Panadol, but it might be because of blood pressure. You guys have always to check up yourselves. Is that right, doctor?
That's right.
I'll just try to give an advice.
But by the way, it's not necessary to be in Prince Salman Center, because Prince Salman Center is a tertiary care. So I think this can be done in primary care.
In any primary care center?
I mean, yes, just urine test and blood pressure measurement. That's it.
Okay. It's going to be crowded after this advice.
Tomorrow. This is why I am trying to say this, that this can be done in any hospital, in any primary care center, and especially those who have familiar kidney disease. I mean, those who have...
Or have relatives with kidney disease.
relative with kidney problems.
Okay, doctor, how long can a patient survive without a kidney dialysis if he needs it?
As I said, that patient, when they reach to the stage of end-stage renal disease, i.e. the kidney function less than 15%, they cannot live without dialysis. Otherwise,
if he forgot the dialysis.
Yes, otherwise they will develop complications. They can develop heart failure. They will develop neurological problems.
Pulmonary.
Yes, and pulmonary lungs problem. They will have symptoms of nausea, vomiting. They cannot cope with life. They will have fatigue. So normally when the patient kidney function is below 15%, we approach them and we recommend them for dialysis, to start dialysis or to have transplantation. And the dialysis are two types, hemodialysis and peritoneal dialysis.
Okay, doctor, how do we get a kidney then? If the patient needs a kidney, what should he do exactly?
Well, our renal transplantation I think is the ultimate therapy for patient with renal failure. Dialysis is a temporary stage only. Yeah. The renal transplantation is the ultimate treatment. And normally patient with renal failure, they get the kidney from the donor. We can say three sources, either from living related or from living non-related. And this is agreed upon by the Council of the Ministers 3 years ago. Previously it was only from related living donors. Now they can also from living non-related. I mean your friend, your neighbor, provided that from the same nationality.
Okay, Dr. Khalid.
And the third, let me finish this one. The third one is the cadaver donor. Cadaver donor means that from dead patient. They sign during their life that whenever they died, they are donating their...
But the kidney should be extracted as soon as they die.
Of course. I mean, there are certain criteria for those patients in order to get their kidney for the recipient patient.
Or from a patient in coma?
Yeah, I mean those who are still having their heart working, but because of a brainstem death, but their heart, their lungs still functioning, and this is still perfusing blood to the kidney, so the kidney is still alive, but they are dead. I mean, brain dead.
Yeah. Doctor, what about the if you have a recommendation or advice for those who don't have this kidney disease? Are there any specific food that they should be aware of to avoid some kind of food?
Yeah, I think it is a general advice I would recommend any person. As far as regarding the food, first of all, let us talk about the fluid intake. They should drink good amount of fluid, especially in hot climate or when they are having excessive exercise. Regarding the food, is healthy food, to avoid junk food, to avoid foods which are very high in fat, very high
fast food in general,
fat food in general, sweetie food, and to avoid food who are fried. I mean, let us make our trend those just grilled rather than fried food. I mean, to increase their intake of vegetable and fruit. So, as any healthy food recommended for any healthy person.
Everything in oil should be avoided.
Yeah, as much as possible.
Dr. Abdulaziz Khalid, Abdulaziz, say Dr. Khalid Abdulaziz السعران, thank you very much for coming to the Adams Apple. You have enlightened us and gave us a lot of useful information that added to me and hopefully added to all the viewers a lot of knowledge. Thank you very much.
Yeah, thank you, Saud, thank you, Muhammad, and thanks for Channel 2 and for Adams Apple program for giving me this opportunity to talk to our viewers.
You're more than welcome.
Thank you.
You're so welcome. Thank you, Doctor, and thank you, Saud. Well, ladies and gentlemen, that's it for now. Inshallah, we'll meet you tomorrow. Thank you for watching. Wassalamu alaikum wa rahmatullah.
Welcome, O Ramadan. You are honored, O month of the Quran. It is Ramadan. O one who sleeps, stand up and declare the oneness of Allah, the oneness of Allah. O one who fasts, stand up in prayer at night, and Allah will forgive, Allah will forgive. Welcome, O Ramadan. You are honored, O month of the Quran. It is Ramadan.